Hey, my name is Abby. Welcome to episode 3 of the Constitution and Healthcare from Michigan Healthcare Freedom. Today, we're finding similarities between the founder's list of grievances in the Declaration of Independence and today's healthcare. It's revealing when you read government here in the beginning of the Declaration of Independence. Let me share my screen here. Starting just on the first section here. Whenever any form of government, or say whenever the healthcare system becomes destructive of those ends, um, life, liberty, and the pursuit of happiness, it is the right of the people to alter or to abolish it and to institute new government or healthcare systems, laying its foundation on such principles and organizing its powers in such form as to them shall seem most likely to effect their safety and happiness. Prudence indeed will dictate that governments long established should not be changed for light and transient causes, and accordingly all experience hath shown that mankind are more disposed to suffer while evils are insufferable than to right themselves by abolishing the forms to which they are accustomed. How long have we put up with healthcare that didn't really work well for us? But when a long train of abuses and usurpations pursuing invariably the same object and evinces a design to reduce them under absolute despotism, it is their right, it is their duty to throw off such healthcare systems and to provide new guards for their future security. It's revealing when you read government here substituting healthcare systems for health policy. Elections serve this role of changing government today, but so do lobbying for policy change and adopting innovative healthcare models. If we go down to the next section, they're complaining that the king has refused to pass other laws for the accommodation of large districts of people unless those people would relinquish the right of representation in the legislature. He called together legislative bodies at places unusual, uncomfortable, and distant from their public records, like their county seat, for instance, or their state capital, for the sole purpose of fatiguing them into compliance with his measures. How many of you have gotten tired of fighting with insurance companies? um, Today, the large districts equivalent here is the healthcare professions. Michigan's legislature, for example, has failed to rein in LARA, the licensing and regulatory administration, with reform, and instead it has delegated rulemaking power for licenses to duplicate authorities, unelected compact commissions, and their appeal process is out of state, similar to the king's legislatures. The next section here, the king had endeavored to prevent the population of these states. Well, right off the bat, what comes to my mind is states promoting abortion. You can't prevent population more directly than that. But at the end of this paragraph, it also mentions raising the conditions of new appropriations of lands. At the time of the founding, appropriation of lands, that land was the way you made a living. And today we have piles of regulations and barriers to getting a job in healthcare. And the effect of that is deterring people moving here and incentivizing people moving away. How many older people have had all of their children leave the state or businesses leave the state? This diminishes Michigan's population and worsens healthcare shortages. Next section here, the king erected a multitude of new offices and sent swarms of officers to harass our people and eat out their substance. This makes me think of Michigan Department of Health and Human Services. It has over 14,000 employees as of last year. That is actually down. And the budget right now is 37.7 billion which comes through our taxes, fees, and fines. And that's not all of state government devoted to oversight for healthcare. Lara and DIFS, it's called Department of Insurance and Financial Services, also regulate Michigan healthcare with additional staff and budgets. Altogether, these departments compose well over half of Michigan's budget. These two kind of go together. The king had imposed taxes on them without their consent and deprived them in many cases of the benefits of trial by jury. When we look at today's healthcare, there are licensing conditions set by boards who are unelected, and there's the governor's executive order for implicit bias training. In addition, we no longer have trial by jury for many of the contested healthcare regulations. You have to go all the way through the administrative courts before you get anywhere near a trial by jury. For instance, in federal vaccine court, it's not a jury. It's not even a proper constitutional court. And in the state, we have child protective service processes, which can be very arduous and certainly don't involve a jury. And last in this list of grievances, for what I see as relevant to today's healthcare, they complained that the king suspended their own legislatures and declared themselves invested with power to legislate for us in all cases whatsoever. Have you ever felt that way about insurance denials? They deny claims, they set up their own rules, they set up their own protocols, and if that's the insurance you have, you don't have a whole lot of choice. You can appeal it, you can drag things on, you can get your doctor to advocate for you, but there is no constitutional process there, and certainly they're not elected. Um, in addition, there's administrative rulemaking at all levels of government that impact healthcare. And CMS, Medicare, Medicaid at the federal level requires state licensing in order for clinicians to bill for reimbursement. So there are quite a few of the similarities, I think, between the situation in healthcare today and the situation with government interference with self-government back at the time of the founding. They Next time we will talk about how the founders designed the Constitution to prevent these abuses and to set a higher standard for government to protect individual rights of life, liberty, property, including conscience. So understanding American founding principles can help us become stronger citizens to take back healthcare freedom. And it's a great time to do that right now with America's 250th birthday. Please like, share, and subscribe to get more of these series. And thanks for watching.